And for survivorship care plans, a survivorship care plan, also called a follow-up care plan, is developed for each child. This plan and schedule is based on the type of cancer and treatment received. For example, some children may need to return for visits each month for the first year after they have completed treatment. Others may not need to return as often. However, all children treated for cancer need to receive follow-up care. This care, as outlined in the Institute of Medicine's Cancer Survivorship Care Planning for fact sheet, includes exams and tests, procedures to check for the recurrence or metastasis of cancer, and a schedule of when they are needed, care and support to manage any long-term side effects and check for late effects, psychosocial support or counseling and referrals as needed, legal and aid or financial support and referrals as needed, referrals to and coordination with specialists such as cardiologists, education specialists, endocrinologists, physical therapists, and psychologists, and to appropriate treatments, clinical studies, and rehabilitation specialists. Recommendations for healthy behaviors such as advice regarding nutrition and physical exercise, family-based care, education, and outreach to your child and family. Survivorship care programs, follow-up care clinics, also called long-term follow-up clinics, or survivorship clinics, provide follow-up care for children who have been treated for cancer. At these clinics, your child will see specialists in cardiology, endocrinology, fertility, nutrition, psychology, and pulmonology, for example, who will monitor your child's health. These clinics are usually found within hospitals. If the hospital where your child was treated does not have such a clinic, ask your child's doctor to recommend one. You can also refer to the clinic's oncology group directory of services to find a hospital that offers services late effects of treatment. Long-term and late effects, we have a comment. We noticed that schoolwork was difficult for Meg. Her nurse at the survivorship clinic told us about testing and steps to get support from our child's school. Although many side effects go away once treatment is ended, long-term side effects such as fatigue may take some time to go away. Other side effects, called late effects, may not occur until months or even years after treatment. Factors that affect the risk of late effects. The risk of late effects depends on factors related to the type of cancer your child had, how it was treated, as well as personal factors. These include cancer-related factors such as the type of cancer, where it was in the body, and how it affected tissues and organs. Treatment-related factors such as the type and dose of treatment or the type of surgery. Patient-related factors such as your child's gender, age of diagnosis, length of time since diagnosis or treatment, personal and family health history, and health habits. Types of late effects. Knowing what symptoms to be aware of and when they may occur can help you plan for the needs of your child. Not knowing what to expect can cause anxiety for some patients. However, for others, knowing about late effects that may or may not happen to their children in the future can be overwhelming. Many parents find it helpful to ask their child's doctor what late effects to focus on at each step of the child's recovery. Late effects may be physical, emotional, or cognitive. Physical late effects involve changes to organs, tissues, and body functions. They may affect your child's growth and development. Some children who have been treated for cancer have many physical late effects, whereas others have relatively few. As you talk with your child's doctor to learn what to expect, you can learn more about treatments that may increase the risk of physical late effects and late effects of treatment for childhood cancer. Emotional late effects include changes to your child's mood, feelings, and actions. Many children are very resilient after cancer treatment. Others experience social and emotional problems. If a child is not sleeping well and no longer enjoys activities that he once did, it is important to talk with your child's doctor about having your child evaluated for depression. Some children develop post-traumatic stress disorder. This anxiety disorder arises in reaction to physical injury or severe mental or emotional distress. Symptoms of PTSD may include having flashbacks about diagnosis or treatment, avoiding places that are reminders of the experience, and being fearful, irritable, unable to sleep, or having difficulty concentrating, as your child's healthcare team to suggest, ask your child's healthcare team to suggest resources for mental health support in your area. Cognitive late effects include changes in your child's ability to memorize, learn, and think. These types of late effects are more likely to occur in children who have had certain cancers such as brain and spinal cord tumors, head and neck cancers, and some types of leukemia like ALL. Treatments such as radiation therapy to the head and certain types of chemotherapy also increase the risk of cognitive late effects. These late effects are also more likely to in children who were very young during treatment, who received very high doses of treatment, and whose treatment lasted for a long time. Children with cognitive late effects may have a more difficult time memorizing or remembering. Excuse me. Learning that's handwriting, spelling, reading, vocabulary, and or math may be particularly challenging. Thinking, including concentrating, completing work on time, doing work that involves multiple steps, problem solving, and planning. Questions are asked when your child has completed treatment. About treatment. Who should we talk with to get a comprehensive record of treatments and medications that a child received during treatment? About practical steps to take home. About practical steps to take at home. What health problems in a child should we be aware of? Who should I contact if health problems occur? Does my child need to continue taking any medicines? If so, for how long? What type of activities may help my child? Are any activities not recommended? What vaccine should my child receive? When should they be given? About follow-up care plan and schedule. Who should I talk with to get a follow-up care plan and schedule for my child? What medical experts should my child see for follow-up care? What tests will be done during follow-up care visits? How often and for what reason? Where should my child go for follow-up care visits? What is the schedule for these visits? About possible long-term and or late side effects. Is my child at risk of having long-term side effects? If so, which ones and how can they be managed? Is my child at increased risk of developing late effects later in life? If so, which ones? How likely are these to occur? How long after treatment might they occur? What type of specialist should my child see to manage these effects? About support and coping. What survivor support groups are available for my child, for our family? What are the benefits to my child of receiving professional counseling? Is there something you recommend for my child? Why or why not? Related resources, follow-up care after cancer treatment, late effects of treatment for childhood cancer, PDQ, introduction to long-term follow-up after treatment for childhood, adolescent, or young adult cancer, COG, long-term follow-up guidelines, COG, from cancer patient to cancer survivor, lost in transition, IOM. If treatments aren't working, there's a comment. It felt like we were giving up, but I knew we weren't. The doctors were honest with us. They told us that Devon was not going to live much longer. I'm glad we didn't put our son through treatment that would have made him feel even worse during the precious time he still had. Although treatment helps many children with cancer, it may not work for all children. If the cancer your child has cannot be cured or controlled, it may be called advanced cancer or end-stage cancer. This section suggests ways you can help your child and make choices about end-of-life care. Ways to help your child. There are many ways, many things you can do to help your child. Exactly what to choose to do and when is a very personal choice. Here are suggestions that have helped others during this difficult time. As for help and support, the people on the child's healthcare team have helped other families facing similar situations. Talk with them to learn what can help your child and family cope with end-of-life decisions, concerns, and emotions. Be honest with your child. Because you want to protect your child, it may be hard to follow how to talk with him about the fact that treatment is not working. Work with your child's healthcare team to get truthful information that your child can understand. Talking honestly with your child, as hard as this may seem, can actually help your child. Help your child to open up. Your child may be picking up cues from friends, family, and others that treatment is not going well. Some children choose to remain silent about what they know or suspect because they do not want to upset you or see you cry. Children may try to protect you from their own worries or fears. Letting your child know that she can share anything with you, can help her feel less scared and alone. Let your child have fun. Take cues from your child. If he feels up to doing something, encourage it, and if he doesn't, let that be okay too. If there is a birthday or holiday that your child is looking forward to, feel free to celebrate that day earlier. For example, it may mean celebrating Christmas in July. Talk with your child about what would be meaningful to her. There are wish fulfillment organizations that may be able to help your child's wishes and dreams come true. Share your spiritual beliefs. Your spiritual beliefs may comfort and help your child just as they do you and others in your family. Some parents find it helps to have a member from the religious community talk with their child and family. Keep making memories. Talk about fun times and special memories. Talk about the many people that your child means so much to. If your child feels up to it, write, draw, or make a book together. Talk about special things your child has done that people will always remember. Some children choose to write letters or give some of their toys to the people they love. Take it one day at a time. As you go through this time, remember to care for yourself. You have come a long way and you are doing an amazing job. You are stronger than you think. Choose to make the most of each day, living fully in the present and in so doing, helping your child to do the same. Sometimes simple things are the most meaningful for both of you and your child. Planning guide. Many teams find it hard to be open about their preferences for medical care. Honest conversations can help teens think through and express their thoughts about what they most want. Voicing My Choices is a planning guide that may help with difficult conversations about end-of-life issues. Topics include treatments your child may or may not want to endure, where he would want to be if the end of life were near, and how your child wishes to be remembered. Having a guide to help share thoughts, hopes, preferences, and wishes can help you and your child make decisions that reflect what is most important to your child. Treatment wasn't working is another comment anymore for our son. The doctor told us that he would not survive. That was the worst day of my life. Still, I knew I had to be strong. When we talked with Ryan, he asked if we would keep running in a race that gives funds to his hospital. Ryan used to love running in this race, even before he had cancer, so now each year we continue to run. End of life care. So comment, no words really for this time. It was hard for all of us. Somehow the doctors and nurses helped us come together so that our son knew how deeply he was and is loved. When children have a terminal diagnosis, usually defined as having a life expectancy of 6 months or less, and are approaching the end of life, they may be eligible to receive hospice care. This type of care provides medical, emotional, and spiritual support. Hospice care helps your child to be as comfortable as possible near the end of life. When treatment is no longer controlling the disease, it focuses on caring, not curing. However, if your child's health improves, hospice care is discontinued and active treatment resumes. Hospice care is very individualized. Hospice care may be given at your home, in the hospital, or in a hospice center. Hospice services include medical and nursing care, home health care services, medical supplies and equipment, drugs to help manage symptoms, spiritual support, counseling, social work services, and respite care. For example, your family is also an important focus of hospice care, your child's hospice. Team may include doctors, nurses, home health aides, social workers, clergy, or other counselors, and trained volunteers. A hospice team member is on call 24 hours a day, 7 days a week. More details, information about end-of-life care is included in the related sources section. Questions to ask about treatment, about active treatment. As basically about end-of-life care, about active treatment, what is the best possible result if we continue with active treatment? What is the most likely result? Are there other active treatments you would recommend with possibly better outcomes? How will continuing active treatment affect my child's quality of life? About end of life care, what is end of life care? What is hospice care? What type of care would you recommend for my child? Why would you recommend it? Would you help me talk with my child after this type of care? What quality of life will my child have during end of life care? What care will be given to help my child be comfortable? Will my child be alert? What educational resources would you recommend to help a child and family? Related resources, end of life care for people who have cancer, making decisions about end of life care, palliative care, and voicing my choices. Looking forward, here's a comment. Some of the carefree innocence of childhood is gone, but in its place, a daughter has gained wisdom, grace, and courage. It may be hard to imagine at first, yet once your child completes treatment, you will likely find yourself thinking less and less about cancer. Over time, the current demands and joys of life will grow in importance. Some memories will fade, others will remain. Some parents say they will worry about cancer, others say it is a worry they choose not to nourish. You and your family may appreciate life more deeply. You may find yourself reflecting on the kindness of family, friends, and even strangers. You may think about how brave your child was. You may remember how you relied on your faith and courage to get you through. As the months and years pass and your child stays healthy, cancer no longer takes center stage. Still, you may choose to remember certain days, such as the day of diagnosis or the last day of treatment, and do something special on those days. You can choose to remember that and think back in different ways. Some families spend a day in the park, others get together with friends, take a trip, or do something for others. While others get together with friends, take a trip, or do something others, there is no other wrong way. So here's a comment. While our family would never have chosen this path, once we stopped fighting it and faced it together, we somehow found one way. Our way. We came out changed, stronger. Now next will be practices that help children integrative medicine approaches. Right? So this is page 79. Integrative medicine approaches can help your child feel better during treatment. This care is given in addition to standard medical treatment, which may include chemotherapy or radiation therapy. It does not replace these treatments. For example, your child may receive acupuncture to help lower side effects caused by cancer. And a comment, a child's social worker explained that complementary approaches were given in addition to, not instead of treatment. We were glad these were used to help our child during treatment. Integrative practices that may help children during treatment. Your child's healthcare team will talk with you about ways to help your child cope during treatment based on your child's age, symptoms, and preferences. Some practices that may suggest include acupuncture. Is the technique of inserting very thin needles about the thickness of a hair through the skin at specific points on the body to control pain and other symptoms. This is based on the belief that vital energy flows along pathways in the body and that health problems occur when this energy is blocked. Acupuncture does not hurt, and even children who are afraid of needles get acupuncture. It may lower fatigue, pain, nausea. Learn more about acupuncture. Art therapy uses the making of art and a child's response to art to improve their physical, mental, and emotional well-being. Art therapy is sometimes used together with psychotherapy. A child can make art alone or with an art therapist. Art therapy may help lower stress, pain, and fear. It may improve communication and social interactions. Biofeedback is a method that helps children learn how to control some bodily functions such as their heartbeat, blood pressure, muscle tension, sweating, and temperature. While learning this technique, your child will be connected to a machine that monitors these functions. Once children learn how to control their body, they may use biofeedback to lower pain and to relax. Learn more about biofeedback and other relaxation techniques. Cognitive behavioral therapy, CBT, is a type of psychotherapy that helps children change the way they think and feel about certain problems and situations. It is used to treat mental, emotional, personality, and behavioral problems. Learn more about cognitive behavioral therapy and other psychotherapies. Deep breathing is a relaxation technique that can help boost oxygen levels, which can help your child to relax. Your child takes deep, slow breaths in through the nose and breathes out through the mouth. Small children can practice deep breathing by blowing bubbles. These exercises may help lower stress and increases relaxation. Learn more about relaxation techniques, including deep breathing. Distraction therapy is a method that can help a child take her mind off painful or unpleasant things by providing a pleasant sensation or interesting activity to capture her attention. Babies can be touched, rocked, or rubbed. Children can play games, watch a movie, read, or do other activities that help them focus on something other than the procedure or the discomfort it may cause. Distraction therapy may help lower pain, fear, and nausea. Learning more about distraction. Guided imagery, also called visualization, is a technique in which your children focused on positive images such as a fun place or experience in their mind. These pleasant images can replace distressing thoughts. Guided imagery may help lower stress, pain, and nausea and give your child a sense of well-being. Learn more about guided imagery and other relaxation techniques. Hypnosis, also called therapeutic hypnosis or hypnotherapy, is a trance-like state of deep relaxation. While under hypnosis, with the assistance of clinical hypnotherapists, your child may feel calm, relaxed, and more open to suggestions. Therapeutic hypnosis may help lower stress, anxiety, and pain. Learn more about hypnosis. Laughter therapy, also called humor therapy, is actually a type of therapy that can help muscles relax and make a child feel less scared. Laughter also causes the body to release endorphins, which can help to lower pain. Books, songs, and movies may also be used as part of laughter therapy to lower stress, pain, and fear. Massage therapy is a therapy that rubs, kneads, and/or touches muscles and soft tissue. It increases blood flow and may be used to lower pain and stress. Parents can be taught to give massages, or a massage therapist can give a massage. If your child bruises easily or has peripheral neuropathy, check with the doctor first. Learn more about massage therapy. Meditation or prayers. Care may help children to relax their minds and bodies, which can improve their overall sense of well-being. They may also lower stress, pain, anxiety, and depression and give your child a sense of hope, peace, and optimism. Music therapy is treatment that uses music to help relieve pain or stress and promote well-being. It is being studied in the treatment of several cancer-related problems and other conditions. Learn more about music therapy. And there are questions to ask about practices that may help your child feel better. Like, how could this integration medicine approach be used to help my child? And other related questions. We'll connect in the next lecture. Thank you.